Welcome, everybody. We have Dr. Katz with us today, and Dr. Katz provides medical and surgical care of different types of eye conditions. He specializes in neuro-ophthalmology and evaluates patients with diseases that affect the optic nerve, affects eye movements, and vision. He specifically has some research interests that include light sensitivity, neurologic conditions such as migraine, and blepharospasm. He splits his time between clinical care, surgery, research, and teaching. He is a fellow of the American Academy of Ophthalmology and a fellow of the North American Neuro-Ophthalmology Society. Dr. Katz is a tenured professor at the Department of Ophthalmology and Visual Sciences and holds an adjunct appointment at the Department of Neurology. Along with his partners, Dr. Stephen Blair and Benjamin Rollins, Dr. Katz founded Axon Optics, which develops lenses for prevention and treatment of migraine headaches. And today we are talking about therapeutic eyewear using special lenses to help reduce symptoms, also known as blue light blocking lenses, or the FL41 lenses. So welcome.
Good morning. It's great to be here. Thank you for inviting me.
You bet. Dr. Katz, you have an experience as a neuro-ophthalmologist in clinic seeing patients, and one of the things that you mentioned in our introductory conversation was the increasing amounts of people you have with vestibular migraine. Here we're talking to the vestibular community across the globe. What can you tell us about your practice, these patients, and why this topic is important to them?
Yeah, you know, the vestibular system is tied so intricately in with the eye movement system that it's not surprising that people with vestibular disorders have disturbances in their vision and how they perceive the world. And so because of those intricate connections between those parts of the brain, people will sometimes assume that there's something wrong with their eyes or the visual part of their brain and come in to see an ophthalmologist or a neuro-ophthalmologist because they think that the symptoms that they're experiencing are due to some problem with their eyes. And, you know, so part of my job is to educate the patient, well, to examine them to make sure there really isn't anything wrong with their eyes, which there usually is not, and then educate them a little bit about what their vestibular disorder might be. And I'd say far and away the most common diagnosis that I make is vestibular migraine. I think these people are more likely to experience visual symptoms as part of their vestibular symptomatology and are more likely to, you know, end up going to an eye doctor looking for answers about the symptoms they're having and how to improve them.
So you're saying that these people come in and maybe don't already think they have a migraine diagnosis. They think they have an eye diagnosis. Why is that?
Right, because migraine is incredibly prevalent. About 16% of women have migraine, 6% of men, but many of these people go either misdiagnosed or undiagnosed. So people don't know that they have migraine, don't realize that they have that migraine predisposition. They're having visual symptoms, and so they go to the eye doctor instead of a neurologist or vestibular specialist.
Well, you're right in that. Sorry, Kathleen. I was going to say, you're right in the fact that everything starts with education. Usually when, you know, sometimes the vestibular physical therapist might pick up on this as well. And when you tell the patient that migraine could be something suspected, they go, well, I've never had a headache. Right. Or I don't get headaches. And, you know, there's got to have that conversation about how this is a neurological issue. And there's so many different things that can be affected. So you're absolutely right when it comes to educating patients, because they have no idea sometimes that this is a possibility.
Yeah, I couldn't agree more. And you know, in the educational process, I do end up spending a lot of time talking about how common migraine is, how it runs in families, and then going through, you know, some of their past medical experiences and saying, well, you know, that thing you had when you were, you know, 22, that probably was a migraine. And people also interpret migraine as an acute illness, like a cold or a flu, where it's actually like a chronic condition that you have probably lifelong. Many migraine patients that I see as adults have are either car sick as children or had unexplained episodic belly pain as children. And some people consider that an abdominal migraine. Yeah, and so it's a lifelong illness that can wax and wane. and can change character over time. But yeah, the education is super important. It's empowering to the patient, but it also is therapeutic.
It's so interesting because it is a lifestyle, it's a chronic condition, you're saying, or a lifelong condition in some ways. And so in terms of treatment, you know, we have, people think about migraines and they might think about a migraine diet and nutritional triggers, dietary triggers, stress, things like that. So
sure.
Can we talk about where, you know, vestibular migraine patients, in your experience, what treatment they get, and then where therapeutic lenses comes in a part of that treatment?
Sure. Vestibular migraine, you know, there are certain medications that seem, you know, that are used for migraine in general that seem to be more effective in particular for vestibular migraine. But it's usually a combination of, you know, education, medication, physical therapy, you know, vestibular therapy. And then, you know, for people that experience light sensitivity as a aspect or a facet of their disease, then there are optical treatments as well that can help relieve some of the light sensitivity and disturbing visual symptoms that patients with vestibular migraine often have.
Which could
tell us about the lenses.
Oh, go ahead.
Oh, sure. Yeah.
Go
so
ahead, Danielle. What were you going to say?
Oh, I was just going to touch on some of the visual sensitivities that you're talking about. Not only the sensitivity to light, but sensitivity to visual conflict. You know, sometimes these vestibular migraines can change the way our eyes move, making it difficult to see things up close or to have our eyes diverge and converge. And there might be it might be a number of different things that can be addressed vision-wise with lenses or prisms that patients have come in and had some success with. So it's just very interesting that it's not just the light sensitivity, but other things that a multidisciplinary approach with an ophthalmologist like yourself can be extremely helpful for with patients that have VM. So please tell us about these lenses, because this is the exciting part of our talk.
So it was just discovered within the last 20 years that there's a particular cell within your eye that's responsible for light sensitivity. So most of your eye is taken up, of course, by vision, you know, by trying to see and vision, but there's a particular subset of cells in your eye that respond to light that's too bright. And it's these cells are protective, like they keep you from looking at the sun or looking at an object that's too bright and damaging your eyes. So when these cells get activated, you experience pain. And it's a signal from your eye telling you, hey, don't look at that. You're hurting me. You're hurting the eye. You're going to affect our vision. And these cells are particularly sensitive to a wavelength of light that's sort of between the colors blue and green. And we've developed a tint that we can put in spectacle lenses that blocks that frequency of light and can turn down those cells, turn down the gain a little bit on those cells so they're not quite as irritated and people have less sensitivity to light. In my experience, people with migraine, vestibular and regular migraine, are particularly sensitive to non-incandescent artificial indoor light. So when they go outside, they can put on dark sunglasses and they do okay. But indoors, they're really bothered by fluorescent lights, these bright halogen lights that you'll see in big box stores like Costco and Lowe's and Walmart. And they're really bothered by LEDs, fluorescent lights. And that's because those lights emit very strongly at that wavelength, at that blue-green color that irritates those cells that cause pain. You can't wear sunglasses indoors. It will dark adapt your eyes and make you more sensitive to light so that when you do go outside, the light's going to be excruciating. Sort of like if you go to a matinee movie on a Saturday and you come outside at 3 o'clock in the afternoon on a summer day, it's blinding, right? Because your eyes are dark adapted from being inside the movie theater. So you can't wear sunglasses indoors. I strongly discourage that for that reason. So we came up with a tint that is light enough to wear indoors. You're not going to dark adapt your eyes and make you more sensitive to outdoor light. But it's dark enough specifically at that particular wavelength of light to give you some relief from the light sensitivity, especially from these artificial indoor light sources. The tint is, we've called it Spectra Shield, and we sell it on our website, axonoptics.com. I'm the CEO of Axon Optics, and along with two of my partners, we run this online company. I basically started it, 10 or 12 years ago because there was, people kept asking me, for some sort of a tint that would help them with their light sensitivity. And there were tints out there, but they were incredibly hard to find, and they were only, in certain places, in certain cities. So I founded this online company so that anybody anywhere in the world, could have access to this tint and maybe find some relief for their from their migraines and vestibular symptoms.
Can you educate us on the name FL41, the lens and blue light blocking glasses, and then of course the differences in different light blocking glasses? Some light block a certain percentage of blue light, and they are transparent or translucent. They don't have color, and then the more blue light you block, the darker the lenses. And I'm interested in that because you said too dark of a lens will be harmful, and that you will be maybe even promoting your light sensitivity by blocking too much light during the day.
Right. So the tint FL41 was originally developed by a group in Birmingham, England, to help people with fluorescent light sensitivity. And it just turns out by, not exactly random, but by sort of by chance, that tint does, blocks the wavelength of light that is most irritating to people with migraine. And so, just over the years, we found it to be incredibly helpful. And then we kind of took that FL41 tint, which is, commercially available, it's not a big secret or anything, but we improved the formulation and tweaked it a little bit to come up with the tint that we use, in our company, which we've called Spectra Shield. But it was, FL41 was the original thing that was developed. Most blue blocking lenses that are commercially available do not block that wavelength of light that I was talking about between the blue and green spectrum. They do block blue light and purple and violet, but they don't really, if you analyze them, they don't block the wavelength that's really important. So in my experience, most, if not all, blue blocking lenses are completely ineffective. They might cut down the intensity of the light a little bit, and that definitely can make people more comfortable. But, therapeutically, they're just not doing what's needed. And so I generally, like, if you go out and buy some blue blocking lenses and you think they're helping, well then, party on, keep using them. But that's not where I would go first. I would go first to something like Spectra Shield or FL41 that actually blocks the wavelength of light that we know is irritating to people with migraine.
Now that's helping to block the wavelength. This is a question from the chat that I wanted to kind of hit on because it's a good question. But those tints help block the wavelength, but not necessarily the visual concept, like a pulsing or like a strobe light type of trigger or something that might bother somebody, right? This is kind of like for continuous light, but not for something that's going to block a strobe-like pattern that might increase symptoms.
That's correct. It's not going to block that kind of strobing effect, but it is going to turn it down a little bit, right? I mean, just by turning, so like, for instance, the optical density on a pair of sunglasses is like 90%. So it blocks 90% of the light. The optical density for Spectra Shield is right around 35%, 40%. And so it's going to cut down the strobing a little bit. It's not designed to do that, but it is going to, as a side effect, it's just going to make it less annoying.
And can these be made into prescription glasses? So if somebody has a type of prescription glass for distance or bifocal with reading, can they have their lenses tinted with the Spectra Shield or the FL41, or is this something that they have to wear separately?
No, it can be definitely integrated to just about any prescription.
Okay, I like that.
And we're actually working on getting into a contact lens.
Oh,
We should
wow.
have that up and running soon.
Yeah,
A little tricky.
that's amazing.
A lot of people who suffer from vestibular migraine and light sensitivity take a deep dive into complementary and alternative medicine approaches and think about hormones and sleep health, sleep hygiene, and things like that. Can you speak to the light intake into the eye and melatonin and sleep, and where these glasses and blocking blue light might have an impact on those hormone levels?
Sure. So that those cells in the eye that I was describing that cause pain when you look at a light that's too intense are also the same cells that keep your body's natural rhythm in sync. So your body has a natural 24-hour pattern that it maintains, and it tells you when to wake up, when to go to sleep, and when to eat. And you've probably noticed that if you travel across, time zones, like let's say you travel from LA to Auckland, New Zealand, which is like 7 hours ahead, I think. After about, maybe 4, 5, 6, 7 days, all of a sudden, like you're sleeping at the right time and and you're waking up at the right time, you're more in sync with, the sun going up and down in New Zealand. And it's these cells that drive that synchronization. So these cells sense when the sun is coming up and when the sun's going down, and it re-synchronizes your body's 24-hour rhythm to match the local conditions. So if those cells get overstimulated, like after the time when the sun goes down and you should be thinking about going to sleep, your body will start thinking that you've traveled, west, and it'll mess up your body's natural sleep and wake cycles. So some people will wear blue blocking lenses when they're using their computer late at night, because computer screens do emit at that wavelength. Some people will wear blue blocking lenses at night, hoping to avoid that problem, that they're going to mess up their body's 24-hour rhythm. But again, these blue blocking lenses do not turn down the cells that are responsible for entraining your body's rhythm, and that's why I just don't think they're effective. We don't really market Spectra Shield, to help people with that, with messing up their body's rhythms. But I would think theoretically that, Spectra Shield is going to have a much larger chance of, cutting down the wavelength of light that's actually, potentially going to interfere with your body's natural 24-hour cycle.
Very good. There's a lot of misinformation out there, and this is why we like to try to have experts on like you to help us clear the fog. So the computer screens can cause discomfort, eye fatigue. Danielle mentioned earlier that it might have to do with extraocular eye muscles. So where that's not those cells on the back of the eye on the retina, but that it's eye strength. Do you think eye muscle strength contributes to some of the sensitivity that these clients have?
I don't think so. Your vestibular system is very intricately connected with your eye muscles, the muscles that move your eye up and down and right and left. But I don't think a particular weakness or strain of those muscles is contributing to vestibular migraine. It might, but I think people often misinterpret their symptoms as straining those muscles. And I can see why, because it messes up the way the world appears.
Mm-hmm. There's also talk online that talks about these, that if we don't use light protective lenses or therapeutic lenses, these lights we get from computer screens might be harmful to the eye or damaging, including increasing the incidence of macular degeneration. Is there truth in that?
Yeah, there is a lot of controversy surrounding whether blue light can be damaging to the eye. And I think the jury is still out, but most people believe that blue light probably does not contribute to macular degeneration or or other diseases of the eye. Certainly shorter wavelengths of light, like ultraviolet, can damage the eye, and but not. I personally don't think that blue light is as big a villain as it's made out to be.
And I like that. I don't want people to get, sidelined by all the hype out there about sometimes things are exaggerated online. And so I want to stick to what we know and what we don't know. And so these glasses in your clients, you're saying, are really helpful for those symptoms. Can you give us some idea about what your experience is with your patients and what they say about these glasses?
Yeah, I don't mean to like brag or oversell or anything, but like for some people, like the glasses can be literally life-changing. Like, if some people have, a lot of fluorescent lights, where they work, and they can't turn those lights off or protect themselves from it. Like being able to wear these lenses makes going to work tolerable, or going to school tolerable, or going to church tolerable. People that, like me, like I'm in my own office, I can turn on or off any lights I want. I have that luxury that I can turn all the lights off all day long if I want to, but most of us that go to work don't have that control over our place of work, certainly not over where we go to school or where we shop. And so, for these people like who've been like not able to go to work or not able to go to school or not able to enjoy family functions, like it's really a big deal. It really can be life-changing, and then for other people, like maybe it makes their vestibular migraines, it doesn't make them go away, but it makes them more tolerable. So like, maybe, if they're having a particular spell that would mean they'd have to go to work or have to miss work or miss school or miss a social function, it just turns down the volume just enough that they can stay at work, they can stay at school, they can stay at a family function and enjoy it. So it really can be, for some people, it can be very dramatic.
Yeah, look at Alicia Wolf. Alicia Wolf is our migraine guru go-to in the vestibular migraine world, and she uses these light filtering glasses as well and swears by them. And a lot of the people that she connects with also have found that they help a tremendous amount. And as physical therapists, our goal is to get patients functional again. We don't want them missing work or even missing out on quality of life. When your life is run by this condition where you don't know if you're going to have a good day or a bad day, they start to not commit to going to family events or parties or hanging out with friends and being out in the public and the community. So something like this, is a great tool that we can give patients that they can do at home immediately to help reduce symptoms while they're still working on those other dietary and lifestyle changes to get them feeling better. So this is a great tool in the toolbox for patients that have light sensitivity and issues with their migraine, vestibular migraine. And another way that I can actually apply this to some of my patients is post-concussion or TBI. A lot of these patients have issues on screens and phones and post-concussion migraine, and these types of glasses can help them get back to being normal sooner. The studies are showing that we want to get these patients back to reading and operating as normal, and we want to avoid those things that would make us more sensitive, like wearing glasses all the time inside. I can't tell you how many migraine patients come into my physical therapy clinic wearing their, full grade sunglasses, and it's hard to tell them, but take them off, please. We'll go in my room, we'll do stuff in there and kind of warm up to it, but don't keep them on. So this is something that will help people get back onto the road of recovery and help reduce their symptoms to make them a fully functioning human being again. So this is something that I think is absolutely fantastic.
Yeah, thanks. And I think you bring up a really good point, Danielle. It's just one facet of treatment. You've got to attack it from the, you've got to talk about sleep, you got to talk about diet, you got to talk about stress, depression, anxiety, and light sensitivity and headaches. And yeah, it's all, you can't just address one piece of it. You've got to attack the headaches and the vestibular symptoms from many different angles.
So this is one piece of the toolbox. Is there anybody who shouldn't use these?
I can't think of anybody. They don't work for everybody, obviously. What does? in my experience, people can put these glasses on and they know within like 5 minutes whether or not they're going to be helpful. So you don't have to wear them for weeks and weeks to see if you're getting better. Most people, put them on and either they say, wow, this is really helping, or they put them on and they're just like, gee, I don't really know if this is doing anything for me. And you're not going to hurt anybody with glasses. Yeah, I can't think of a single contraindication, reason not to use them.
Right. So you said most people feel it right away. Is there an amount of time that you tell your patients, try them for this amount of time, or how long does it take before they know if it's going to be helpful? And then the second question is, once you use them and you find them helpful, do you have to always use them? If you remove them, will you potentially have those symptoms recur?
Right. That's a great question. I try to get people to wear them for at least a couple of weeks before they give it the thumbs up or the thumbs down. Axon does have a money back, guarantee. So and I think it's for 30 days. So if within 30 days you're not noticing any improvement, you can, send them back. In terms of I don't really know that people become dependent on the glasses. I mean, certainly if you find something that makes your symptoms better, you're very hesitant to want to stop using it. Mm-hmm. But it's not like we're trying to retrain your body so that eventually you won't have to use them. So if you find them helpful and your symptoms are continuing, then people generally continue wearing them. But it's not like you need them to be darker or a different wavelength. It seems to be you can pretty much stick with the same product and get the same benefit. The benefits don't seem to go away with time.
There's no developed dependence on it, is what you're saying. This is something to kind of help, again, a tool in your toolbox to kind of help with symptom mitigation. And these are something that can keep you functional and moving while you look at the other multidisciplinary approach to your care, like changing the medications with your doctor and going through physical therapy and, hitting all the other stages along the way. But these glasses are something that are to help you manage that and feel good as you're going through all of those other treatments. It's not, this is a cure-all.
Exactly. That's exactly right.
So you have a specific kind of lens at Axon Optics that you feel like is better than just something someone would pick up off the shelf or with other manufacturers. And in the chat, they're asking if you can put them in a prescription, and are there any limitations in the prescription lens that can go with your specific patented lens? For example, a very high index lens and like -6.5 astigmatism. Is there any restrictions on being able to use that lens on?
I haven't, it seems to me that we can put our tint into absolutely any lens. We just have not run up with any problems. We've even figured out how to do transition lenses, which are the ones that get dark when you go outside and get lighten up when you come inside. Polarized lenses are a little bit difficult, but in terms of any prescription, I don't care how nearsighted you are, how farsighted you are, how much astigmatism you have. It shouldn't be a problem to integrate the tint into that prescription.
That's excellent. Any concerns for people who've had lens replacements and cataracts? No,
none at all. The nice thing about, when you get cataract surgery, you have an artificial lens implanted to take the place of the natural lens that's been removed. And all of the intraocular lenses on the market block ultraviolet. Cool. Just inherent in the material. So the Spectra Shield is very safe for people that have had cataract surgery. Oh, and they also come on, and we also, have clip-ons. So, for people who want to put it on when they go outside and take it off, or they don't want to have the tint on if they're not symptomatic, you can just pop them off.
This is a more question for my own personal intrigue, but how do the light filtering lenses compare to something like night shift mode? So before I was aware of all the different types of lenses that can filter that stuff out, Apple came out with night shift where they kind of made your screen a little orange or your phone a little orange. We did that a lot with post-concussion patients. How does that compare? Is that helpful? Is that a sham? What's your opinion on that?
I think that is helpful. No, I think that's the real deal, but they're actually using the science, behind those cells that cause light sensitivity to alter the spectral, emission of the screen. No, I use it myself. I think night shift is super helpful.
That's good to hear.
That's a good strategy for people using not only their computer monitors, but also the cell phones do that as well. So yes, I think it's nice to see the science integrated into the products, and then us being able to protect our eyes and protect from headaches and things. Anything else, Dr. Katz, that you have thought about that you want to make sure we know about these glasses, and where you think the future holds for it?
Yeah. So I guess, the biggest message that I want to get out there is that you might have migraines and you might not know it, and that it's a chronic condition. Controlling light sensitivity, it's just one facet of treating the condition. It's an important facet, but it's just one facet. You need to address the other things that we've talked about. And in terms of what's in the future, we're partnered with a company in Canada called Avalux, and they're working on a lens that has the same spectral property as the Spectra Shield, but does not have a color. It just appears, to the naked eye, it just appears gray. And we're really hoping, because the Spectra Shield has a little bit of a rose color to it, and so it does cause a little bit of color distortion that some people don't like. And also sometimes kids, especially teenage boys, are reticent to wear glasses that have kind of a pinkish or rose color to them. And so we're pretty excited about working with Avalux to come up with a tint that's as effective but maybe doesn't cause the color distortion. And then also, integrating either the Avalux formula or the Spectra Shield formula into contact lens is super exciting. We do have a patent that we just had approved using nanoparticles to get the same spectral effect that we're trying to get with Spectra Shield. And with nanoparticles, you could potentially integrate that, blocking that wavelength of light. You could integrate it into a windshield, into a window, in a hospital or a clinic or your house, into a computer screen or a cell phone screen. So I think that's what I'm most excited about, is developing this nanoparticle technology that you could use in just about any optical application.
That's very cool.
How does someone who has a need for expertise like yours find somebody like you to consult with in their area?
Yeah, many, I'd say probably most ophthalmologists and most optometrists don't know about these cells in the eye that I'm talking about, or how they play a role in the light sensitivity in migraine and traumatic brain injury and some other light sensitive conditions. Most neuro-ophthalmologists do know about it. So if you Google, actually the website is Nanos, Nanos, web, web.org. So that's the North American Neuro-Ophthalmology Society, and they have a link on their website where you can find and identify a neuro-ophthalmologist in your city or state or country.
Mm-hmm. That's helpful. That's helpful because there is a difference between the optometry and the ophthalmology and the neuro-ophthalmology. So I want the public to understand that the ophthalmologist is a full-fledged medical doctor. In fact, with different training than optometry. And I know that some of the optometrists have their own particular niche of addressing migraine and vestibular problems with eye exercises and the oculomotor things and different kinds of convergence weakness exercises and visual therapies of some sort. But the medicine of the eye, the MD part, understands that physiology perhaps and some of these things in a different way. Would you say, I mean, what would you say the differences are between an optometrist and an ophthalmologist for the help of a vestibular migraineur?
Yeah, it is super confusing. Most people don't know the difference. So an optician is somebody who works in an optical shop, and their job is to help, fill a glasses prescription, fit it to your face, make sure that it's the right prescription and that the lens characteristics are correct. An optometrist is somebody who's gone to optometry school, and in most states, optometrists are limited to medical diseases of the eye. And ophthalmologists have all gone to medical school, and they've all completed a residency in ophthalmology before they're allowed to go out and practice. And they deal with medical and surgical problems of the eye. And then within ophthalmology and neurology, some of us have subspecialized into neuro-ophthalmology, where we have a particular interest in how neurologic illnesses affect the eyes and vision. I don't really have a strong opinion about seeing an ophthalmologist versus an optometrist. The important thing is that you see a good one. Like, I'd rather you see a good optometrist than a bad ophthalmologist, So the thing that I would recommend to people is go to somebody has a good reputation, maybe on the recommendation of a friend, colleague, or family member, somebody that's reputable. If you are looking at an ophthalmologist, you can see if they're board certified. That's going to be, it's kind of the good housekeeping seal of approval if somebody is board certified. You brought up optometric exercises. I do see some patients, especially patients with traumatic brain injuries, who are seeing optometrists and getting some visual exercises to kind of help improve some of their visual symptoms that they're experiencing after a concussion or other traumatic brain injury. And I'm just a bit skeptical. I've never really seen any good proof that they're effective, and they can be expensive, and insurance doesn't pay for them. So but on the other hand, I've had patients who say that the exercises are helpful to them. So I'm not saying don't do it, but I'd say go in with a skeptical eye. Sometimes it just takes time to get better, after a brain injury.
Mm-hmm. Very, very good advice. I really, really appreciate your expertise. You've given me and our audience, I know, a lot of great information about it. Anything else from you, Danielle?
No, this was very engaging. I learned a lot as a clinician and as somebody that can talk to my patients now about these types of lenses and utilizing them to help with symptoms. So thank you so much for coming on with us today and talking to everybody about these light filtering lenses. This has been great.
It's been my pleasure. Y'all have a good day and a good weekend.